Friends, let us discuss about homeopathic drug Apocynum cannabinum. Its common name is Indian hemp. It is a plant with tough fibers which are used to make strong ropes. It belongs to family Apocynaceae and the prover is Freytag. This drug mainly acts on kidneys, digestive tract, uterus, heart and respiratory system. It has a great action over the kidney. It increases the functional activity of that organ. It is reputed to be a very good remedy for dropsy, hydrocephalus and ascites. All these conditions indicate retention of fluid in their corresponding sites, so this drug helps in their elimination. This drug is very similar to Apis in dropsical conditions, but the differentiating feature is that Apis is hot patient and Apocynum is chilly patient. Coming to mind symptoms, the patient is low spirited and bewildered. That means depressed and confused. She feels as if she could do nothing but cry. Physical generals. All the excretions are diminished, especially urine and sweat. So we'll see dropsical condition. This whole drug is about dropsy. What may be the particulars? We'll see dropsical conditions. So dropsy is with thirst. It is also seen in acetic acid. In acetic acid, thirst is burning, intense, insatiable even for large quantities. When it comes to Apocynum, there will be thirst but water disagrees or is vomited. This symptom is also seen in arsenic album. In arsenic album, along with dropsy, they'll have deathly prostration, deathly anxiety and restlessness. Coming to Apocynum, dropsy comes after typhus, typhoid, scarlatina, cirrhosis and after abuse of quinine. Particulars. Head. There will be hydrocephalus with open sutures. Fontanelles grow wider. Due to increased intracranial pressure, it compresses the optic nerve, so sight of one eye is lost. This pressure also impacts on brain functions, particularly the areas responsible for consciousness. So there will be stupor. We'll also see constant and involuntary motion of one arm and one leg. It is also seen in Helleborus. And if it is left arm and leg, then it is seen in bryonia. Projected forehead is also seen. In hydrocephalus condition, there will be increase in flow of urine which has been scanty all the time. Due to dropsical condition, face seems to be bloated, puffed and swollen. There will be bloating under the eyes which are pitting upon pressure. No symptoms are long continuous sneezing and snuffles of children. Snuffles is nothing but noisy breathing as we see in cold. This symptom is also seen in Sambucus. Coming to GIT symptoms, the tongue is dry with great thirst and stomach is thirst on waking. He likes cold water but it disagrees, causing pain in stomach or vomiting sets in before it even gets warm or causing uneasiness. So he does to take cold drinks and warm drinks make him comfortable. There is gnawing hunger. Gnawing hunger means persistence and intense feeling of hunger which is painful, but mouthfuls make him feel distended. Whatever he eats, it will not digest. So there will be sensation of pressure in epigastrium and in the chest. It is impossible for him to get breath enough to move. Dropsical conditions are alternates with copious discharges. Dropsy relieved with copious yellow watery discharges from bowels or by urination. It is so profuse that he thinks that where does all this water coming from? When it all ceases, dropsical conditions progresses again. Coming to urinary bladder, the urine is scanty and bladder is much distended. Turbid and hot urine with thick mucus is seen. There will be burning in the urethra after urinating. Little expulsive power, so there will be dribbling due to incomplete voiding. Female reproductive system. She'll have amenorrhea with bloating or dropsical extension of abdomen and extremities. As we saw in urinary system that dropsical conditions alternates with profuse urination, here also amenorrhea alternates with metrorrhagia. So symptoms like prolonged menorrhagia or hemorrhage from the uterus for 6 weeks are seen. Blood is expelled in large clots sometimes in a fluid state. There will be moderate flow for a day or two, suddenly sets in with such violence that she cannot be out of bed. She becomes exhausted, which compels her to lie quietly. This might be the reason that she thinks she could do nothing but cry. She'll also have palpitations, pulse is quick, feeble, and faints respiratory symptoms. Hydrothorax. He must sit up and cannot lie down. And there will be oppression of epigastrium and chest, so respiration is short and unsatisfactory. Cough is short and dry or deep and loose. Cough during pregnancy. It is also seen in conium. Heart symptoms are mitral and tricuspid regurgitation, which is rapid feeble cardiac action, low arterial tension, pulsating jugulars, and general cyanosis and general dropsy are seen. Skin is dry. No matter what his complaint is, he cannot sweat, so skin feels husky, rough, but he is chilly. Remedy relationship. It is similar to acetic acid, Epis, Arsal, China, Distalis in dropsical conditions. Blata orientalis has cured bad cases of general dropsy after the above drugs failed to cure. Comparison of Apocynum and Epis in dropsical conditions. In Apocynum, he is chilly patient. His complaints are worse from cold applications, cold drinks. Whereas in Epis, he is a hot patient. His complaints aggravate in warm, heated room. Ameliorated by cold bathing, wants to be uncovered. In Apocynum, there will be great thirst in dropsy, but water disagrees. In Epis, there will be thirstlessness, especially in dropsy. That's it about Apocynum cannabinum. Thanks for watching. Bye.